So case four is one of my patients, and this is a pretty neat patient. He's a 32-year-old professional fighter. And I think one of the take-home points with this is we learn a lot as we move on. And not only did he have a small stump, as you can be visualized here on his preoperative MRI, but he's someone who basically had determination, but also wasn't going to necessarily follow a slower protocol. And so, based on patients like this, we were able to sort of move forward with some more advanced rehab protocols just from understanding the dynamics around this. But okay, this is a 32-year-old male who has a fight that he states he will not miss in 12 months. So you see his MRI here with a very small tibial stump that's left. 9 months out, here's his ACL. It looks really fantastic in this BEAR sequencing MRI. He was part of our BEAR 3 clinical trial. And one of the things that's important to note is, again, he accelerated his rehab very early on. He was bending the knee much more than even I was comfortable with in the first 2 weeks, 4 weeks, and 6 weeks. But he really focused on really strengthening up the knee and understanding, the right things to do with the knee kinematics in his rehab. Here it is again, a T2 image again showing that normal sagittal and coronal plane, rather, of the MRI and the T2. He ended up getting back to that fight. He ended up fighting at 10.5 months and actually won his title, his first title. He's 4-0 since coming back from his BEAR ACL right now. And really, it's a testament to what you can do with good science and determination, as well as understanding how the body wants to heal itself if given the opportunity.